So I don't know and understand why whenever I record, my videos always end up being two separate videos, and it only should just be one. But needless to say, my video stopped, so this will be, I guess, a continuance to the other video. But I believe I was saying that I had high blood pressure, and I'll just get my blood pressure and everything checked on Thursday. I get my staples taken out on Thursday. So far, everything is good. Just enjoying these precious moments with the babies, and seeing how this is the first time that I ever got this far. Everything is so new to me, but I'm willing to accept and take up on the challenge of these beautiful babies, and I'm just still in shock. Like, these are my babies. I actually had babies. So I do know one thing is that I tend to show my stomach, and I don't have a problem showing it. But right now, I'm actually just in the bed, and I still have on those little panties that the hospital give you. I'm not bleeding heavy, which I never really did bleed heavy. So more than likely, the bleeding will stop here soon. I don't even have enough blood to fill up a pad. So that's how I know that it's I don't bleed that heavy. So I'm just actually comfortable right now, and I'm just in my bed, and I just got on those little mesh panties and the little pad that I have, and so I would show you the belly, but I'll say that for a later date. It's still kind of shaping back. And there's this thing that I honestly didn't even know. It's called a binder. It's pretty much like a belly band that the hospital provide. I don't know if they bill it to your insurance or whatever, but it was, to my knowledge, it was free. So if they bill it to your insurance, it's not free. But I didn't have to pay anything for it. My cousin, she had a C-section, and she was like, make sure you ask them for a belly binder because it helps out a lot. Helps out with your posture. It helps out with your back. It helps out with your stomach, trying to get everything back into place. So I have been using it, and it actually helps out with my back really, really well. I do know that my doctor told me that I'm going to have abdominal reconstruction done, because he said that my abdominal cavity or my abdominal walls has been stretched out to where it won't go back together, which I kind of understand a little bit because back in 2009 when I had my emergency C-section, I had to go to physical therapy afterwards for my abdominal walls. So pretty much the way I perceived it is as if someone was weighing 300 pounds and they lost 200 pounds and their skin just sagged. So right now I got the extra belly skin that's just hanging there, but then again it's still a little swollen, and I don't know how it would end up being at the end result, but I am wearing that band to help out. And I did ask him, well, when would be the best time to do the reconstruction? He was like, well, we wouldn't suggest you do any type of surgery until 3 to 4 months after your uterus shrinks back to normal. And he was like, but even still, by you having newborn kids, I wouldn't suggest you do anything until they're about 2 or 3 years old, because he was saying that, you would have to be on downtime, of course, from recovery, and you'll end up missing a lot out with the kids. And he was like, it's just better to do it when they're older. So, of course, I will look into it when that time comes. I'm not really worried about it right now. Of course, I want that beach body. I'm going to try to work for it myself first, but if the skin in my abdominal cavity is the way, my doctor says it is, which